How has it been for you having this disorder for the 6 years, because you started from 10 and now you're married?
Yes, well, I'll say I've had life-threatening situation. There was a time I spent almost 2 years bedridden.
2 years?
Yes, it's difficult to believe. Within this period, I spent almost 1 year on admission at the University College Hospital in Ibadan. Then I have what they call multiple osteomyelitis, that's multiple bone infection. So that's one of the things we are prone to. So all my bone, I have infection all over the body, and I spent almost a year there. At the end of the day, I have to go through surgery because I have to do hip replacements. That explains the reason for my walking stick.
What does hip replacement mean?
Even most of us in the family agree about that when this person survived. But there was time I bypassed out completely until about the third or fourth day before I gained consciousness.
We'll begin today's conversation taking our quote from Elizabeth Edward, an American attorney, author, and healthcare activist. She once said, "You recognize a survivor when you see one. You recognize a fighter when you see one." Okay, let's take our second quote, and this one is from Patsy Kensit, an English actress, model, and lead singer of the band Eighth Wonder in the 1980s. She once said, "Life isn't perfect. When you get a knock, you have to get up, dust yourself down, and get on with it." Absolutely spot on. Our last quote is from Bruce Feiler, an American writer and television personality. He is the author of 15 books, including The Council of Dads. He once said, "When faced with challenge, happy families like happy people just add a new chapter to their life story that shows them overcoming the hardship." Interesting, you say. Now let's see how all of this quotes relate to what we will be discussing today. Very warm greetings and welcome to The Conversation. We are reaching you from Kaftan's television studio here in the nation's capital, Abuja. Of course, I am Annabelle Oji. Now, what is sickle cell disorder? That's SCD. Sickle cell disorders are a group of illnesses which affect your red blood cells. Sickle cell is a genetic condition, which means it is passed on from parents and you are born with it. You cannot catch it from other people. That should be stated. Now, sickle cell disorders causes your normally round and flexible blood cells to become stiff and sickle-shaped, stopped the blood cells and the oxygen that they carry from being able to move freely around the body, causing severe pain. This can cause episodes of severe pains and all. Now, these painful episodes are referred to as sickle cell crises. They are treated with strong painkillers such as morphine to control the pain. Now, people with sickle cell are also at the risk of complications of stroke, acute chest syndrome, blindness, bone damage, and priapism. That's a persistent painful erection of the penis. Over time, people with sickle cell disorder can experience damage to organs such as the liver, the kidney, the lungs, the heart, and spleen. Death can also result from complications of the disorder. Treatment of sickle cell mostly focuses on preventing and treating complications. So, just as it sucks to sometimes get up in the morning and your bones decide to do their own thing, so also it is really frustrating to not be able to do the things that you want to do. To take the cold drinks that you want because the weather calls for it, to play football because you have a passion for it, or to just be spontaneous. Whether you are living with sickle cell disorder or you know someone, probably a sibling, a friend, a neighbor, colleague, a schoolmate, or even an employee who has sickle cell, you already know that it requires a lot of strength and motivation. We all know and understand how crazy it is to constantly be on medication ranging from folic acid, that's the smell alone is enough to knock you out completely, to ibuprofen and many others. The excruciating pain that gets you tied down in the hospital bed for days, weeks, months, even years. They need some sort of motivation and inspiration to keep them going, more like a hug, either physically or virtually. Just be nice, that's what I'm saying. Like they say, if you cannot say nice things to people, don't say a word at all to them. Do well to be kind to these people. Shine the light for them to see. I'm not actually talking about pitying for them, but try to inspire them to live life not just as a sickle cell patient, but as someone who has a lot to achieve. Help that person through the journey of life. So, to help us commemorate the month of sickle cell awareness, my guest on the show today is Shehu Mohammed, managing partner at Shehu Mohammed & Co., that's it, chartered accountant. Shehu Mohammed is a seasoned professional with over 25 years cognate experience spanning professional accounting practice, commerce and finance, both in public and private sectors. His areas of expertise includes financial reporting and analysis, audit and assurance, taxation, strategic business development and implementation, financial advisory, enterprise risk management, project management, and human resource management. He has attended several executive management training programs, both locally and internationally. This includes the Lagos Business School, Howard Business School, Washington, D.C., USA, and the Manchester Business School, UK. Shehu Mohammed is a sickle cell survivor, or warrior like they prefer to be referred to, and he is the author of the book, I Am a Survivor. Now, the next 60-minute interview with Shehu Mohammed, that's a sickle cell disorder warrior, on living and dealing with sickle cell and listening to his survival story will not only educate you, but also richly inform you on the disorder. Don't miss this. We'll be right back in a moment. I will be your host. Welcome back. If you just joined us, this is The Conversation. We are reaching you from Kaftan's television studio here in the nation's capital, Abuja. If you just joined us, you're right on time for the interview. Our guest on the show today is Mohammed Olaitan Shehu. He is a sickle cell disorder patient, and we will be hearing his story today. You're welcome to the show.
Thank you very much.
How have you been?
Very well.
Great.
Yes.
All right, now let's start by getting up close and personal. Tell us about you and what was your childhood like growing up as a sickle cell disorder patient. Tell us your personal story or experience.
As you were introduced me, I'm Shehu Mohammed. I'm a sickle cell patient. I'm 56 and I'm a chartered accountant.
56?
Yes, I'm a chartered accountant.
Okay.
Yes, I run my own auditing firm here in Abuja. Yes, growing up as a sickle cell patient is a hard story to tell, really, because it's an experience of pain, anxiety, and I would say hope. Pain is just that the one thing that is common with us as a sickle cell patient is bone pain crisis. You are constantly in and out of hospital, being treated for one illness or the other, but the whole thing revolves around the pain you go through, then the anxiety you put your family members and loved ones, the fear that will this person survive, and of course the hope that yes, he will survive, he will make it, he will overgrow sickle cell. And here we are today. The hope has been manifested.
Oh wow.
Yes.
We'd actually like to hear hear more of your experience. Now, you've told us, I was about to ask you how old you are, but you said you're 56. Are you married?
Sure.
You have kids?
Yes.
Okay,
with some of them married.
You're even a grandfather?
Very soon.
Whoa, really? So how has it been like? Because, okay, let's start with first. At what age were you diagnosed of the disorder?
Well, the sickle cell story of myself, I'll say it's not only about myself, my other siblings that are also sickle cell patients.
How many of them?
My mother had 4 of us that are SS. All are male children. Yes, all our male children are SS. 3 of us survived to adulthood. And so that's the story. But I was diagnosed at the age of 10 with sickle cell. Before then, it was my elder brother that is known to be SS. And his own tale is even worse than mine, because in his own case, it's right from childhood, maybe around 1-2 years that it has been manifested, but me until I was 10. But even then, at that age of 10, it has been a story of in and out of hospital. And sometimes you spend weeks in the hospital. Our mother have to sleep in hospital. The father have to be going up and down. They carry us to many other, sometimes this thing, they feel that, look, it's not just normal hospital you have to go. You have to try traditional medicine. Okay. Spiritualists and things. Those are all the things we experience while going up. And of course, as a child, the stigma, this person is SS. Of course, that one is there too, especially among your peers when you are in school. People making jest of you because you cannot do what ordinary child would do. The way they would play in the rain, you can't try that, because if you try that, the next thing is falling sick. So this has been the experience. But as time goes on, especially by the time I'm through with secondary school, but even in secondary school, you find out that when you expect people to even know, even some of your teachers
to understand,
that understanding is not there, really. So this has been the childhood experience generally.
So how's it been for your siblings that also have the same disorder?
Well, my siblings that have the disorder, they are late now. One due to have his own children before he died at the age of 37. The other one was in part 2 in the university when he died. But all in all, at least to some extent, each one of us has some fulfillment, I would say. Yes, but it has not been that easy, especially for the parents experiencing this thing about their children. And so that's why to us that are in it, we always try to preach that, look, you have to be very careful. Prevention is the best thing you can do to avoid all the pains that goes with sickle cell.
All right, so are you the only one left out of your siblings?
Yes. Wow. I want the male. All the female are around, because none of them is SS. Only the male that are SS.
So does it mean that it's actually prevalent with male children?
No, it's not. It's not. This thing just happened. Like the doctor will tell that, look, there's, for each birth, there's 25% chance that the child will come out as SS. That is, if AS and AS go married. For each birth, there's that possibility. Of course, each birth, there's only that if this one is like that and you have had one SS, then that means that the remaining 4 will not be. No, each one is mutually exclusive, because it's a matter of probability. So that's how it is. It could be male, or the child will come out as male or female. It could be anyone. But definitely for each birth, there's a possibility that it could be 25% probability that it could be SS.
All right, so now I'm aware that you talked about the pain. So I'm aware that there are the dark moments when you have the crisis, some very painful episode. Walk us through what it was like for you.
Well, I put out all those experiences together in my book. There's a book I wrote, which I launched last year. I call it I'm a Survivor. In the book, I told a story about those dark moments that sickle cell make you go through. Sometimes you are just in a depressive mood. I just feel, oh, why am I doing why do I really have to go on with life? Why do I have to even struggle for anything? When I know that in the next moment, I may be down with illness, and then I will be at the mercy of people around me. I won't be able to do anything on my own. So why should I really bother? These are the dark moments one has when going through sickle cell. But at the same time, you still have some glimpse of hope that look, no matter how bad it is, you can survive it. And luckily enough for me, I've been very lucky with access to health care.
Okay.
Because one of the things for us as sickle cell patients is prompt access to health care, especially emergency care at that time when the crisis comes up. The one thing about the crisis is that sometimes it gives you notification that it is coming. And you too can know that, look, you have to quickly do this or that to prevent crisis.
So what is the symptoms that you get?
Sometimes you feel that you just feel this tiredness. You just feel that there's some little pains coming up. At that moment, the next thing for you to do, take your analgesic, take lot and lot of water, and take complete bed rest. Sometimes it works to retard the pains, and if you observe that for over some hours or a day, you may not have the crisis. But at the same time, there are some occasions that the crisis will just come, just like a thunderbolt.
Wow.
You are playing with all your colleagues, gisting, laughing. The next thing, you just feel that you are just sitting at the corner. The reason why you are sitting is that you are in severe pains.
Wow.
And the next
so pain is that crisis?
Is that crisis. And it can happen to any part of your body.
Oh.
It can happen to any part of the body, though in most cases it's within the bones, the chest, but any part of it you can feel the pain. You know, the whole thing is about sickle cell is a blood disorder. So it's the blood that has issue. And since the blood flows through all the parts of the body, the blockage that the sickle blood causes, it could happen in any part of the body. But this is the reason why some of us do have severe complication. Some people can have some organ damage. Imagine blockage within the vessels taking blood to the brain. Yes, it could be as bad as that. Vessels taking blood to the heart. Wow. And you're having crisis around those places. If there's no immediate emergency care, it could be fatal.
Wow.
Yes. So that's the reason why I said, for someone like me, yes, I would say I'm part of the lucky people that, look, I have access to care. Okay. Because of my background. Of course, it's not so for many other people. And this explains the reason for the prevalence of complication most of us has, prevalence of death, because people from poor economic background may not be able to afford what it takes to take care of a sickle cell patient.
I can imagine. So how has it been for you having this disorder for the 6 years, because you started from 10 and now you're married?
Yes. Well, I'll still say that ultimately we give time to God. We give praises to him that, yes, it has given me maybe I'll say enabling environment, in the sense that I have a loving family, my parents, my extended family, friends. Everybody have been so helpful to me. The first time I will go out of the house to live on my own was when I went for A levels.
Okay.
At Federal School of Art and Science in Ondo. That was between 84 and 86. And luckily for me, I have friends that I quickly make friends that were there for me. And one thing about myself is that the moment I met you, I always let you know that, look, this is my situation.
Okay, okay.
I could have this problem, so please, this is what I would like you to do for me.
Okay.
So people always know. Okay. Unlike some of us, because of their previous experience about stigma, people want to hide. They don't want even people to know that they are SS. That's one thing that's opposite in my own case.
Okay.
I'll let you know. If you want to be my friend because of that, fine. If you don't want to be my friend, fine. Another person.
And that has helped you?
It has really helped me.
Okay.
Right from A levels, even when I was in the university at Ife, the same thing. My roommates other friends will be there to take me to the health center. The moment they know that I'm in crisis, or I inform any of them. So this has really helped. And of course, growing up, I make friends with people that I know that are, let me say, relevant to my healthcare. I have many medical doctors that are my friends. Any of them, I can call on them anytime. Look, this is my situation. I'm coming to the hospital. I need your assistance. So this social network has been very helpful.
Your grace.
Yes, it has been very helpful for me.
All right. So we actually know that growing up as a sickle cell patient, only when growing up, actually, we know that they have this particular lifespan that they live for, and when they exceed that lifespan, they don't stay. You just hear that they are actually dead. Yes. But we give thanks to God for you. You're 56. So what exactly was it like? What was that saving grace that you have? Is it the fact that you were open to healthcare, receiving healthcare, medications and all of that? Is that the saving grace that you had?
Well, I'll say yes, but at the same time, I'll say that, you see, sometimes all of us, we don't have it the same way as sickle cell patient. The severity is different for each person.
Oh.
That's why you can take two sickle cell patients now. Their experience may not be the same.
Oh, okay.
What is my own precipitating factor to my crisis may be different from another person. And the severity of what may I have, another person may not have it. Even there are some people that you will see that you won't believe that they are SS. They will be so chubby, live normal life. Some people are lucky like that. So I'll take it that there are some things you can't just, even science, they can't understand that. Why is sickle cell A manifestation different from this sickle cell B manifestation? So sometimes it's the level of the manifestation. There are some people that every other month they have to receive blood transfusion. Every other month. There are people like that because of the complication, because of the severity of what they have. So I'll say perhaps in my own case, the severity is not as bad. But even then, I've had life-threatening situation. There was a time I spent almost 2 years bedridden.
2 years?
Yes, it's difficult to believe. Within this period, I spent almost 1 year on admission at the University College Hospital in Ibadan. Then I have what they call multiple osteomyelitis. That's multiple bone infection. So that's one of the things we are prone to. So all my bone, I have infection all over the body. And I spent almost a year there. At the end of the day, I have to go through surgery because I have to do hip replacements. That explains the reason for my walking stick.
What does hip replacement mean?
You see, there's this complication that most of us are prone to. They call it AVN, vascular necrosis of the head of the femur. That is, you see the bone at the hip. You know, if you take a chicken bone now, remember the biscuit bone at the so that biscuit bone for us, it wears off.
Wow.
So the bone of they will now be impinging on each other. Instead of that biscuit bone to be there to protect it, is no more there because of the consistent lack of blood flow to the place. So that thing has worn off. So your hip will now be fused together. So the free movement you have that you can move is no more there for us. The whole thing is free. So you have severe pain. So except they don't do what they call, of course there are many options that are available for hip replacement. So that's what they will now do for us. So that period for me is when I know that sickle cell really shook me, because even most of us in the family are people that, will this person survive? Because there was time I passed out completely until about the third or fourth day before I gained consciousness. So you can see that it's not a joke. Yes.
All right, so now still talking about sickle cell disorder and all that you've gone through. Now we know that this month is the Sickle Cell Awareness Month, and then it's always celebrated or commemorated every June 19th.
Yes.
So now we're actually aware that there's some things that are done during this to commemorate this activity. So why is it so important to set aside one day, 24 hours in a day, irrespective of your time zone, to commemorate this day?
Well, it's important because we have to realize that sickle cell, the numbers in the community that people that are infected, and the impact on their social life generally is not something you can just keep quiet on. Okay. So the significance is that it creates awareness for people to know that there's what is causing. Up till now, some people tell that they don't even know about it. They don't know what is genotype. They don't know what they need to do to prevent they having offspring that are SS. So one of the secrets of the day is that, look, it keeps that awareness in the front burner. Then again, another thing is that it lets people know that there are some people that are living with this disorder and that they need special care, and that people should pay attention to them, and that they need empathy and understanding when you are dealing with them.
So would you actually say that Nigerians or Africa in general, we've been actually paying enough attention to sickle cell, to the awareness, aside the one-day commemoration or celebration?
For that, what I would say is that things are better than what it used to be.
Okay.
At least we now know that there's a day for it, and we know that there are so many NGOs now that are doing many things for the sickle cell community. And in most cases, you find out that these NGOs are being spearheaded by sickle cell patients themselves. So it's a good thing. So with all this, I would say that yes, the awareness is better than what it used to be, but we can still do more. It's not enough for us to just say that people are aware. What are we doing with that awareness? How do we measure the impact? Impact in the sense that are sickle cell patients having more access to health? Is there more knowledge about genotype test? Are people taking advice that, look, they should avoid situation in which they will have offspring that will be SS? Are they aware that, okay, this is the best way that you can help a sickle cell patient? Or if we have a study on this criteria, we can and see the outcome, we can now know, okay, the awareness is bringing difference. Okay. But we need to do more.
So now here you talk about genotype. How important is it to actually know your own genotype and that of your partner, so as to know when it is time to go, if it is actually right to go on with the relationship or just friend zone that person?
If you have seen someone in crisis before, you realize that the pain of crisis is not something that you can take for granted. I know some female friends that will tell you that the the pains of crisis that you have when you are in pain is more than the pain that a woman has when she's in labor. So with that, I know how the labor pains is being described, but for a woman to say that the crisis is even more severe than that, with that, you know that this is not something that should be taken for granted. As such, for any would-be lady or guy that wants to thinking of getting married, even before then, as a teenager, you should know your genotype, and you should know the reason why the knowledge of genotype is important. So by the time you know that you are AS, okay, this is implication for me. This is the type of person I can marry.
Well, who's the kind of person that you should marry?
Okay, for AS, in fact, anybody that have the S tract, either AS, you are AS, SS, SC, your best bets get someone that is AA.
Okay.
The reason for that is that at the end of the day, the worst case scenario you can have is AS children. None of them will be sufferer of will be SS. Okay. So that is the essence of knowing your genotype. At least it guides you. And what we always tell teenagers is that, look, even from the first start of a relationship, if you are just being friends, fine. But if you want to advance that relationship to the one that, okay, we want to get married, the first thing, in fact, of all your criteria, of course, every individual have many things they put on their checklist. What should be the first checklist is the genotype. So that if you take that one, then you can now say you want to check the other one.
How about the blood group?
The blood group, I remember one of my doctors said that, look, if you are waiting for blood group, that the one that match you may never get married in your life. So forget about usual blood group. Okay. The important one is that genotype. The blood group, I think they have many things they can do within science to control that one. But that genotype, that one is very, very important. It should not be joked with.
Okay, so now let's talk about the bone crisis associated with the disorder, because you've talked about the episode that you went through for over 2 years.
Yes.
So aside that, was there any other one that you...
Of course, I had an interview where I was saying that, look, over the years, if they have to count the numbers of times I've been on admission, I would have been on admission for more than 200 times.
Wow.
So you can imagine, for more than 200 times, yes. And for each admission, you can now estimate how much it will cost in terms of finance, in terms of man hour. The man hour is not only you that you are there, your families are there. People that are supposed to be at their business, they are not there. Even you that are supposed to be at your workplace, you are not. How will your employer see you? Will they say that, oh, this person is really worth keeping him as an employee, or we should just get rid of him? And unfortunately, of course, that's not the case in my own case. Unfortunately, for many sickle cell patients, they have this discrimination even on job placements. But I'll say that, yes, maybe that's why I said in my own case, I've been maybe a little bit.
So you never faced any of those stigmatization?
I did not.
Because I know that you're an astute accountant and a professional.
Yes, in fact, for my professional background, I was sometimes, before I left Daily Trust, I was the Chief Financial Officer, CFO of Daily Trust, the General Manager of Finance, then later General Manager Management Services, before I retired from Media Trust to now start my own practice. Like I said, I'm a chartered accountant. I'm a fellow of the Institute of Chartered Accountants. And of course, I have other certification. All these things have really helped me in my own case.
All right.
And this is what I always tell my fellow sickle cell patients, that look, we need to develop ourselves. We should not take things for granted. No matter what pains we are going through, you should have the expertise, so that even when you get to the workplace, you have something you can prove that, look, I can do this.
All right then, we have more to unbundle from this conversation. Let's go on a quick break, and when we return, you'll get to hear more. Do stay with us. We'll be right back. So I hear you talk about you have to avoid malaria.
Yes.
So now I'm aware that malaria is just one thing that sickle cell patients don't ever pray for.
Yes.
So aside malaria, how much does it affect sickle cell patients, and also how much does climate change, either extreme hot weather or cold weather, how much does it affect your kind of person?
So there are some things we avoid. One, mosquito. Of course, mosquito cause malaria. Extreme weather condition, either too cold or too hot. I know when I'm growing up, anytime there's rain and I was in the rain, then most likely I will have crisis.
Wow.
Because of the rain.
Welcome back. If you just joined us, this is The Conversation. We are reaching you from Afton's television studio here in the nation's capital, Abuja. If you just joined us, you missed quite a lot, but then you can still join in the conversation. Our guest on the show this morning is Mohammed Olaiton Shehu. He is a Sickle Cell Disorder Warrior. I'm sure that's what they call them.
Yes,
Warriors.
that is it.
So what is the difference between a warrior and a survivor? Is it the same thing?
Well, it's the same thing. It's just terminologies, and some people feel good calling them this, showing that yes, they don't want to be pitied. Exactly.
Okay, now when you talk about PT, because I know that a lot of them don't like the pity party. They don't like the sympathy.
Yeah.
Is it the same thing for you?
Definitely.
Okay.
We like to show that, look, we are not just a burden. Just like any other person, we have ambition. We have things we want to achieve. You look at what you aim to be, and you don't want to be a burden on anybody.
Okay.
And all you want is that little push or little encouragement from people around you. So when I was talking about employment the other time, see, if you go to many interview, some do hide the fact that they are SS because they know that in most cases people have this prejudice against them. Because the first thing, if you hear of SS, that the first thing that comes, oh, this person will be absent from office. If absent from his work, he won't be able to do the work. If you give him or her a deadline, he won't be able to meet the deadline. So as such, even you are not given that opportunity to even prove yourself on the job, no matter the expertise you have. That's why I find that in many cases, some of us go into private things you can do on yourself.
Okay.
But we know some people are in paid employment and really doing fine. I was there, and I know that I excel in what I did.
All right, great. Now, so during those days, those weeks, months, even years that when you went through that crisis, either at home or in the hospital, how much did all of that affect you mentally, physically, psychologically, even academically? Because I actually saw that you've been a member of some academic institute. I actually read up and saw all of that. So going through your profile with all that you've achieved so far, how much did all of that deter you at any moment?
Well, I'll say it has both the encouraging parts and of course the discouraging parts. Let me take the negative side of it. You are always in this moody situation. Sometimes you are down with depression, and you have to go through a lot of counseling and people encouraging you that, look, you can't give up. Even if because of your family, you have come a long way, people put much hope on you. It's not at this time you just sit back. You just have to do things for yourself. And this is what I would say that my parents have been able to do for me, especially my dad. We always encourage you, look, forget anything about sickle cell. You must stand on your own. And that push has always been there. But as human being, just imagine I'm planning for an event. Yes, and even one of the main organizer, a day or two to the event, I just broke down. I could not be there. I could not attend. So you have this mood of, oh, am I really old? Am I like any other person? Is it that I'm half human being? That feelings all do come sometimes, but at the same time, you get people to encourage you. You read books on motivation that, okay, you can still come out of that. Of course, I do come out of it. On the positive side, I will say, and this is one thing I always say in many other interviews that I did, that sickle cell in its way has been one of my motivating factors to help me excel.
Oh, wow.
And it's like this. When I'm in school, I know that, yes, I could fall sick anytime. So I make sure that my reading, anything I'm taught today, I try to read it immediately so that I understand. If we are given an assignment, maybe you have to submit in a week's time. I finish my own assignment maybe in 3 days. So that, yes, even if sickle cell want to come up, if the class want to come up, I've done what I need to do.
Okay.
So I always do my work ahead. And this helped me when I was in paid employment. I find out that even many job assignment that's similar that they will give to other people that you want to say that they are normal in quotes now. They will take weeks to do it. But me, the same assignment, give it to me, I'll turn it up to my boss within days, even before the deadline.
Oh, wow.
And I always do that for the reason that, look, I don't want this job to be delayed because of my sickle cell. So, because I don't want to give anybody excuse. So, because of that, my bosses always throw even more complicated assignments at me. Because of that, this is the person, yes, this is the person that will deliver. So I'll say that's why I say in some ways it has really helped me. Okay. Yes.
All right, now, so people with sickle cell, first of all, let me ask you, since I already told you that we grew up knowing that they live to a particular span of years, but now you are 56. Does it mean that when you cross that age, the person can never die again?
You see, there's this notion that people always have that by the age of 18
or maybe 21
that the rate of crisis of the pain subsides. You don't have it frequently as you used to have. I told you about my book, all this in addressing in it, but this is a real fallacy. The reason why people always put that age of 18, 20 or 21 is because that age is noted as age of discretion. That at that age, you can now take care of yourself.
Okay.
You know what is good for you. You know you know that you should take your medication because we are on medication for life. So instead of your parents nudging you to go and take your medication, you know, yes, I have to take it myself. I need to avoid mosquito. I need to avoid stress. So all those things that before it is your parents that are nudging that do this, don't do that. The do's and don'ts of sickle cell, they are the one guiding you, but now you can do it yourself. So, and people believe that if you stay within the do's and don'ts strictly, you won't have crisis. So that's why they always say that by 21 it will stop. But it's not always so. You find that for some people, it is even at that period that they now have serious complications that comes with it. So that I've not been having this thing before, now why is this so? So that's why I said earlier that, look, the manifestation of sickle cell is different for different patients. In my own case, yes, it could have been, it's like this, but another patient, it may not be so. So there's no hard and fast rule about that, really.
All right, now thank you for actually addressing that part. Now, so people with sickle cell are also we know that they're also at the risk of complications like stroke,
yes.
Acute chest syndrome,
yes.
Blindness, bone
yes.
damage, and
yes.
even priapism. So
yes.
how much did all of that, did it affect you at any point?
Yes, it does. Of course, several times. Of course, priapism too, I've experienced it several times. But like I said, prompt attention has helped me out of it. When I said earlier that, look, sickle cell affects every part of your blood flows through every part of your body. In fact, that's why sometimes it is sickle cell is referred to as multi-system disorder. That is, can affect any system of the body. Why is like the blindness you mentioned, everything still boils at that. The blood, the vessel, when blood is flowing through, maybe the one around the eye, there's blockage. So now it causes some real damage because of lack of oxygen to vital organ. So one can have it, that explains the reason for all those. Some of these things I've experienced them, but what really helps me, like I said, is prompt medical attention.
Okay.
Many people that you see that have serious complication, in most cases, not in all cases, is because of that lack of immediate attention. But because even though I said in most cases, not in all cases, because you find out that you still have some people that they have the best of medical attentions. They have the best, they go to the best hospital, they are seen by the best consultants in all areas, but still they still succumb to sickle cell disorder.
Okay.
Yes, that's one area that perhaps we, as people of faith, we say that that's how God has destined it. But I know it do happen in many instances that despite all the, you have people that have even gone for bone marrow transplant, that they think, okay, this has cured, they've been cured, but even complication that will come back because of that transplant will be the source of death. All these things are there.
All right, so at this stage, how often do you experience crisis, either minor or major crisis?
For me personally, I'll say it has been more than 4 years now. In fact, more than 4 years that I had crisis last.
Oh, wow.
Yes. I'm on some medication, which in my own case, it's working for me. It does not work for everybody. There's this drug they call, the shortcut is Hydra. Is it available
everywhere?
Yes, it's available.
Okay.
I was introduced to it by my doctor, and luckily enough, it worked for me. Okay. But first, we find that it doesn't work for some people. That's why I said that the manifestation is different. Yes, some people too, it's doing. They find it very good for them. Of course, it has its own side effect too, but it's not for you to weigh the side effects, so not whether to take it or not. But I'll say that I've been working, and I know that there's some new innovations now that are coming up. Many medications that are being introduced to the market, some are working, but for you to know whether a drug works for you or not, you have to take it for a very long time. Oh, okay. For you to really make that conclusion.
Do you actually see treatment to this, or is it just management all through your life?
I'll say it's management. One of the things that I always advise my fellow sickle cell patients that ensure that you attend the hematology clinics. There's a sickle cell clinic that's periodically we have to attend. Even up to now, so I do attend clinic. Okay. At least every 3 months, because of in my own case, they give me every 3 month appointment. So that means that on the average 4 times in a year, I have to go to the hospital for checkup, check all the blood parameters, how's your kidney doing, how's your liver function. I
also realize that they actually affect kidney and liver too.
Exactly, of course it does. Oh, wow. You know, these are these organs have some special work they do in purification, in blood production. So, and our case is issue of blood. So there's no way it will not affect it. So that's why constantly the check on those two organs are very important.
Okay.
So that's the reason for why one of the reasons why we go to the hospital. Some people, they give their appointment as short as just 4 weeks. They have to come back and redo the test, check how they are doing. Okay, this one you have this we are seeing these symptoms, so these symptoms, so you have to be on this medication, you have to stop this, don't take this is what you have to. That's the essence of that clinic.
Okay.
Unlike some people that will just sit at home and things will be going bad without they knowing. If you go to the clinic, it can preempt many complications.
Okay, great. Now, so when you had this crisis, or when you were isolated, either at home or in the hospital, do you actually have any idea what they were doing to you, what was happening at that moment, or you just lost it completely?
I think initially, I will say that I do lost it completely. That just wondered, what are these people doing again? What are they going to? What is the next thing they're going to do for me? But at the time, especially by the time I entered the university, I started reading on my own about sickle cell. And this helped me a lot in knowing about what it is all about. And as such, now, even if I go to the hospital with some presentation, in most cases, I discuss with my doctors freely.
Okay.
Why do you want to give me this? Why don't we try this? What's the essence of this? In fact, by the time I do my blood test, I go through it myself first and ask them the range they give for normal for XYZ parameters is 41 to 50. But my own is reading 35. Why is my own reading 35? That means mine is out of the normal range. Explain why this one is to me.
Oh, okay.
So all those ones, they are important that one know at least a little. Then you need to engage your doctors. So this engagement that I have with the doctors makes things work for me. Yes.
All right. Now, so during those crises, did you ever had that fear that this could just be it? At this one, I am done and dusted?
I would say I don't have that. I never had that feeling of that I will not survive it. I always have that positive mind.
Great.
All true. Even at the darkest of moments, when that 2 years, because that period was really a real trying period for me and the whole family. Because before that, I never had blood transfusion. I was around 25 years old then. I never had blood transfusion. And one thing about sickle cell patients is that we do have regular blood transfusion, most of us. Some have it as frequently as every month or every other month. But in my own case, not on the 25. So that's period that I said even I lost consciousness. But even when I regained consciousness, yes, I was in severe pain. Everybody was worried. But not for once did I feel that, no, this would be the end.
Okay.
Yes.
All right. So I hear you talk about you have to avoid malaria.
Yes.
So now I'm aware that malaria is just one thing that sickle cell patients don't ever pray for.
Yes.
So aside malaria, how much does it affect sickle cell patients? And also, how much does climate change, either extreme hot weather or cold weather, how much does it affect your kind of person?
So there are some things we avoid. One, mosquito. Of course, mosquito cause malaria. Extreme weather condition, either too cold or too hot. I know when I'm growing up, anytime there's rain and I was in the rain then, most likely I will have crisis.
Wow.
Because of the rain that I went through. So that's one of the things. And of course for us, stress. Stress can trigger one crisis. That's why some of us in most cases find that students, we are prone to have crisis maybe around exam period.
Okay.
I know that I have that experience in my final year at school. Yes, I had that experience once. The reason is that you want to catch up with the Jones. Everybody is reading late. You want to join them. And by the time you do that, you're already stressing yourself. And we are not used to stress. So that thing can bring off your crisis. We are the type that even emotional situation, you are in a depressed mood, and you just feel it could affect your system. Yes, depression could, it's just psychological feeling, emotion, but it can result to the physical pain and prop up the illness. So many other things for different people. That's why for me, I try to avoid AC as much as possible. Yes.
Oh.
Whatever, okay, the moment I say that I'm there, the AC is too much for me, I'll tell that, please, can we reduce this?
Do we need to turn off this one?
No, we don't have to. This one is okay. This one is okay. So I'm just telling you to know that these are small things that other people do take for granted, but for us, it's a really big tool. Don't take it for granted.
Okay.
Yes.
Okay, now, so when we're talking about what are the general treatments that, whether, because you said it's actually different strokes for different folks.
Yes.
So what are the general treatment that someone who is suffering from sickle cell disorder can actually have? That's one on the side. And then secondly is, how were you able to boost your immune system? One,
the general treatments is that we have about 2 or 3 medications that we take for life. One is folic acid.
Okay.
Yes, the other one is malaria preventing medication, paludrin. Yes, and sometimes all these multivitamin, yes, Bico and things like people take it. All this helped not only to one prevent malaria, because that's one of the major things, that the other one help the stability of your blood, and of course it also help your immune system too, and of course good food, good nutrition. That's your best bets.
Are you supposed to avoid any kind of fruits or food?
Not to the best of my knowledge. There's none that I don't take.
Okay.
But the only thing is that one of the things that we avoid, that they always tell us about, is taking blood tonic.
Okay.
We don't.
Oh.
Because the reason being that most blood tonic contains iron.
So you have to stay away from iron.
Iron, exactly.
That means you have to stay away from unripe plantain, those kind of food.
Well, those ones are natural. You can take them, but even those ones, make sure that you don't take them
in excess.
In excess,
okay.
Yes, because there's something they call iron overload, which have serious effects on us. So we know we are designer personality, so to say.
So for that routine drugs, I know that
yes.
You have to either change them, because at some point your body resistance now gets too acclimatized
yes.
to it, so you need to be changing them. Do you have to take something lower or higher at some point?
You in most cases you take something higher. You take them as higher dose. Depend. Like me now, I have a friend that told me that, informed that she takes folic acid 3 times in a day, but in my own case, I only take it once in a day.
Oh, okay.
So you see, that was our manifestation is different from mine. So that explains. But all those nitty-gritty, your best bet is your doctor that can explain that.
Okay.
Yes.
Okay. Now, so are there some kind of platforms or support groups, communities where you all go to and you indulge yourself, where you can hold hands together, share each other's stories, at least suck up strength from each other and help each other to heal?
Yes, there are. One, this is one of the role that all these hematology clinics supposed to play. That is at the part of the hospital. It's not just for you to go there, say, doctor, how are you feeling, and you go. There is supposed to be a forum for you to meet other sickle cell patients and discuss how you feel. But unfortunately, the setup of the hospital, this is one thing that maybe we still talk about it. The setup of the hospital is not that friendly for you to have that discussion, because by you already been delayed. They give you 10 o'clock appointment. Your doctor will not come around until around 12:1. So by the time you see your doctor, you are already exhausted. You just want to see him and leave. But if the place is arranged in such a friendly situation that even there could be some pep talk before the reconsultation, that would have helped.
Okay.
But I know there are so many Sickle Cell Foundation, I belong to some, that are really helping.
Oh, okay.
There are. You have so many WhatsApp group, and personally, I have one.
Okay.
Now, I told you about my book, which I launched last year. One of the things I did from the process of the book launch was that I have this foundation, and one of the things we do is that we have about 100 indigent sickle cell patients that will enroll on NHIS for free. All over the country, we pick people, but we know that yes, these people are of low income group that readily they cannot afford medication. So people like that, we put them on NHIS, which has been very helpful for them. And I know so many other sickle cell foundation that are owned by sickle cell patients also, that are really doing marvelously well in those areas.
All right, even as we begin to round up, our time is fast spent. So did you have ever at any point blame your parents for all that you're going through? Because a lot of people will say, after all, you knew that you were not compatible. Why did you have to go ahead with this? Why did you even have to give birth to children? Did you at any point get to that extent?
Yes, I had that thoughts. I made mention of it in my book. In fact, the way I put it is that, why is it that, I'm just trying to quote what I wrote, that why is it that it is me and that have to be going through the mistake these people made? Why am I the one suffering for it? As if it's not enough. The same thing with my sibling and even the male children of my mother. Of course, we are from a polygamous family. Why are we the one now bearing the brunt? Definitely that thing comes to mind. I will now wonder that they could just have avoided it. But in fairness to them, at that age, at that period, they don't even know.
Have the awareness.
The awareness. Even now, many people still don't have the awareness. That's just the unfortunate part of it.
All right, now, we'd like to get your last word to people suffering from the disorder, and especially to intending couples who are still dating and then they intend to get married, and how they should know if they're compatible, go check their genotype and all. Let's get your last word on this. Last word
for my fellow sickle cell patients, honestly, I just want them to know that, look, it could have been worse. Whatever you are going through now could have been worse. If you look at around you, there are some people you are still better than. So as such, you must never give up. No matter the pains you are going through, never give up. Just keep hope alive and know that with hope, you can survive it. For would-be couple, there's always this saying that love conquers everything. But honestly, by the time you have a sickle cell child, you have to be going in and out of hospital. You know that sometimes you will question whether the love really worth it. So my sincere advice is that they should look before they leap. Ask yourself, does it worth the trouble? And make the best decision for yourself. But as much as possible, know that the best cure for sickle cell is prevention. Prevent having offspring that will have it. Thank you. It has been a wonderful conversation talking to you, Mohammed Shehu. What a wonderful conversation. Thank you so much for availing us your time. Thank you for giving me the opportunity. I appreciate it. All right, viewers, you've heard it all. Thank you so much for tuning in. I'm sure that right now you must have been rightly educated and informed. We've been chatting with Mohammed Olaiton Shehu. He is a warrior and sickle cell disorder patient, and it's been a wonderful time here on The Conversation. Keep watching The Conversation, because you never know who my next guest will be and what my next topic will be all about. I'll see you again next time. From the nation's capital, Abuja, I am Annabelle Oji. God bless Nigeria.